Bismillahirrahmanirrahim. I'm Dr. Nizamuddin Uthmani, working as assistant professor, medical specialist, and gastroenterologist and pharmacologist at Khaybar Medical College, Peshawar, and I welcome to all of you to my YouTube channel. Today we are going to discuss one of a very important group of antibiotic, that is the carbapenems. These are the beta-lactam antibiotics and these are the bacterial cell wall inhibitors. So what are the learning objectives for today's lecture? Describe the carbapenems, describe their different types, describe their clinical uses, and then describe their adverse effect, and then describe their mechanism of resistance. So carbapenem, they're the gold standard antibiotic, and you can say these are the best choices for those infections which are resistant to other antibiotic and those disease, those conditions which you think are the life-threatening or very severe for the patient. The first one antibiotic in this group is the Imipenem. And the second one in this group is the Meropenem, the third one is the Doripenem, and the fourth one is the Doripenem. So we have got four antibiotics in this group: Imipenem, Meropenem, Doripenem, and Ertapenem. So these are the four antibiotics in this group. And the mechanism of action of these drugs is same like that of the other beta-lactam antibiotic. They inhibit the bacterial cell wall. They inhibit the bacterial cell wall and they block the penicillin binding protein. The one mechanism what we have discussed already for the penicillin, they have got almost the same mechanism of action. It's bind to that penicillin binding protein and it's block the bacterial cell wall inhibit synthesis, and thus these work as a bactericidal antibiotic. They have got a little bit difference from the penicillin because they have got sulfur in the thiazolidine ring. You know, beta-lactam antibiotic, they have got two rings. One is the thiazolidine ring and the other one is the beta-lactam ring, and that's why we call them as the beta-lactam antibiotic. In all these beta-lactam antibiotic, they are hydrolyzed or metabolized by the beta-lactamase enzyme. अगरचे बाज़ antibiotic beta-lactamase को ज़्यादा resistant है, बाज़ कम resistant है, लेकिन all of them they are metabolized up to certain extent by the beta-lactamase enzyme. So we have got four antibiotic in these carbapenems. One is the Imipenem, Meropenem, Doripenem, and Ertapenem. Now coming to the first one, that is the Imipenem. Imipenem is a very good antibiotic. It is active against the gram-positive and the gram-negative. It is also active against the Pseudomonas infection, which is one of the resistance type of infection in which produces a lot of the beta-lactamases. It is metabolized by the renal dehydropeptidase. This is a very important sentence in this presentation, that Imipenem is metabolized by the renal dehydropeptidase enzyme and its toxic metabolites. जब ये इसको metabolize इसके metabolism करते हैं, it make its toxic metabolites. So there are two you can say disadvantages of this process. Number one, it's destroy the drug. It's metabolized the drug, so it destroys the drug. And the second is that it's make the toxic metabolites of the Imipenem, which damage the kidney. So we usually combine this drug along with another drug, what we call as the cilastatine. We combine this drug with another drug, what we call as the cilastatine. So cilastatine block that dehydropeptidase enzyme, and they can protect this drug, and they can protect the kidney from the adverse effect of this drug. So it is usually given orally. It's reached to all body fluid, including the CSF. It is excreted by kidney, and it is metabolized by the renal dehydropeptidase enzyme to the toxic metabolites. So dose adjustment is needed in the chronic renal failure, and usually the common dose is 500 milligram or 750 milligram. The other three drugs in this group are the Meropenem, Doripenem, and Ertapenem. We will discuss all of them together. All of them, they have got the same mechanism of action as that of Imipenem. All of them have got almost the same adverse effect as that of the Imipenem, and all of them have got almost the same indication and contraindication is that of Imipenem with the little differences. So we will discuss those differences. Mechanism is same as that of Imipenem. That doesn't need the cilastatine. We gave cilastatine along with Imipenem because cilastatine block that renal dehydropeptidase enzyme. It's block the synthesis of the toxic metabolites from the Imipenem. But Meropenem, Doripenem, and Ertapenem, all of them, they doesn't need the cilastatine. Meropenem and Doripenem, they have got the same spectrum of activity as that of Imipenem, but Meropenem is more active against the Pseudomonas. So this is another MCQs in this discussion, that which one of the following Carbapenem is more active against the Pseudomonas? So that is the Meropenem. Meropenem is more active. Ertapenem is not effective against the Pseudomonas. It has got a longer plasma half-life and it is usually given one stage. We don't routinely use the Ertapenem, but in Ertapenem you just remember two things. It has got the same mechanism, the same adverse effects, same clinical uses. Lekin two things which are different in this drug is that it is not active against the Pseudomonas, number one, and it has got a longer plasma half-life, so it can be given once daily. The dose of Meropenem is 500 to 1000 milligram BD or TDS. So routinely we use two drugs. One is the Imipenem and the other one is the Meropenem. Doripenem and Ertapenem, they are not routinely used. All of them, they should be given carefully. All of them, including Imipenem, Meropenem, Meropenem, Imipenem, Ertapenem, and Doripenem, they should be given carefully in renal failure. Dose adjustment is needed. All of them can cause allergic reaction, so test dose should be given. And all of them can cause nausea, vomiting, diarrhea, eosinophilia, neutrophilia, and even can provoke seizure at higher doses. So these are the adverse effects of all these drugs. Now, to summarize this lecture, Carbapenem, there are four types: Imipenem, Meropenem, Doripenem, and Ertapenem. All of them, they have got the same mechanism of action as that of penicillin, because they block that penicillin binding protein, and they block the synthesis and the cross bridging of the peptidoglycan, and thus they destroy the cell wall. So basically, these are the cell wall inhibitors, and these are the bactericidal antibiotic. They have got a very good spectrum, a wide spectrum, and they are active against a number of gram-positive and a number of gram-negative bacteria. Even they are also active against those microorganisms which are producing the beta-lactamase. Though they have got the beta-lactam ring in their structure, but it's a bit resistant to the effect of the beta-lactamase. So we use these drugs for that as well. Imipenem is different from all these because it is metabolized by the renal dehydropeptidase. And by the metabolism of this drug, there is the formation of the toxic metabolites. So this renal dehydropeptidase enzyme, it's destroys the drug and it's make it toxic metabolite which can damage the kidney. So we use another drug which is called as the cilastatin, which is a renal dehydropeptidase inhibitor, and thus it's prevent the metabolism as well as the toxic metabolites formation of the Imipenem. With Meropenem, Doripenem, and Ertapenem, we do not need the cilastatin. Meropenem has got the same spectrum as that of Imipenem, but Meropenem is a bit more active against the Pseudomonas. So this is another MCQs. And then Doripenem has got almost the same spectrum of activity as that of the Imipenem and Ertapenem, but we don't routinely use the Doripenem. And then the last one was that of the Ertapenem. Ertapenem is a little bit different from the rest of all because it is not active against the Pseudomonas and it has got longer plasma half-life. The common adverse effect are the renal adverse effect and the diarrhea, nausea, vomiting, eosinophilia, and allergic reaction. So the test dose is needed for all these drugs. Remember, Meropenem is a very good drug against the salmonella infection as well, and we are nowadays used in resistant cases of enteric fever. We usually treat with Meropenem. It's a bit expensive drug, so it should be carefully given, but if you have no other choices, you can use this drug. With this, I came to the end of today's presentation. The description of all these antibiotics is given in the link, so you can go there in the description, and you can go there and you can read it from that. Thank you very much.